The CDC just reported its highest number of average COVID cases on record. A surge of Omicron cases across the country has contributed to the now 265,000 COVID cases per day on average. This number breaks a record 250,000 cases per day set in mid-January, which comes from data by Johns Hopkins University. As cases have gone up, so have hospitalizations in the past 2 weeks. The CDC reporting that new hospital admissions have risen by around 20% since mid-December. Earlier today on CBS This Morning, CDC Director Dr. Rochelle Walensky added some context and information to help explain why the agency made its recent changes.
First, we know a PCR test would not be viable because that PCR can stay positive for up to 12 weeks, for months and months. But for the antigen, this is a really important question, and that is because we don't know how this antigen performs with regard to predicting transmissibility towards the end of your period of infection. We know it performs really well during that period where you're initially infected, but the FDA has not at all looked at whether that correlate of your positive antigen really does correlate with whether you're transmissible or not. So with a negative antigen test, we'd still ask you to wear a mask. With a positive antigen test, we
wants it to be clear people need to follow those new guidelines for these recommendations, in order for those recommendations, I should say, to be helpful. There are a lot of questions right now about the virus. If you get the sniffles, how can you tell if it's COVID-19, the flu, a cold, or a sinus infection? Well, we've got you covered with a simple breakdown on how you can know the difference. Here's what you need to know. Right now, the main symptoms of the Omicron variant of COVID-19 are a runny nose, headache, fatigue, sneezing, and a sore throat. The common cold, you'll normally endure a sore throat, a headache, sneezing, and runny nose. And the flu will bring on a high fever, sore throat, muscle or body aches. Something you will not experience is trouble breathing. At this point, with the quick spread of COVID-19, it might be better to be safe than sorry. If you're not feeling great, check in with your healthcare provider if you need to go and get tested for COVID-19 or the flu.